Hello everyone. So, I am here with a new lecture of antiviral drugs. In this we will consider about the viruses and then we will see what is the therapy to treat various viral infection. Yes. So, there can be many infections with the virus like hepatitis is one of the viral disease, yes, which is caused by hepatitis B, C, okay, D viruses, and influenza is also one of the condition which is caused by influenza virus. Okay. So, there are many viral diseases, viral infections for which we have the antiviral drugs. Yes. So, antiviral drugs they all are working on these steps, some steps of the viral replication. Yes. Now, we will first see what are the steps of the viral replication. Okay. Then ultimately, we will understand yes how the mechanism of the antiviral drugs are. Okay. So, first step here is the fusion of the virus to the host cell membrane, okay, and penetration inside the cell. When there will be penetration, because the viruses they are in the some coat, they have the capsid layer, okay, and inside of these capsid layer there is some genetic content, it could be DNA or RNA. Yes. So, when they are penetrated inside the cell, there will be uncoating. Okay. After the uncoating, that uncoating occurs and there will be formation of early proteins which are required for the survival. Okay. So, early proteins means like DNA polymerase, they are synthesized. Yes. When the primary component which is essential for the formation of nucleic acid, here we are giving the name early proteins. When these are formed, the nucleic acid DNA or RNA are synthesized. Yes. When DNA and RNA are synthesized, the formation of functional proteins will be there, which is known as late proteins. Yes, final functional proteins are synthesized and they are processed. Okay. When these all things will form inside of the host cell, there will be packaging. Okay. After the packaging, there will be assembly. New viral coats, new viral these viral agents or viral particles will form. Okay. So, viral particles are released from the host cell and they started to cause infection of in the other cells. Okay. So, this is how these viral particles are formed and spreading the new infection, okay, to the other cells, and the same procedure will be there in the new cells. Yes. Now, see the mechanism here which I already told you, this is in the diagrammatic form. So, first it is started with the attachment. Okay. Here is the viruses, we can see these are the viruses. Now, these viruses will go and they will start to attach with the specific host cell. So, recognition of specific host cell receptors. First they will recognize where to go, where to attach, okay, where will get the supplements of the survival, the material for the survival, yes, where they can grow. So, recognition of specific host cell receptors. When they will recognize, these viruses will recognize, they will enter. Second step, yes. Penetration by endocytosis and membrane fusion. They will fuse, okay, in this area. When they will fuse, it will enter in the host cell, this starts the uncoating. So, the capsid layer, it will disrupt, it will deassemble, and whatever the viral genome is present inside this viral particle, it will be released. So, here we can see there is a release. Yes. Now, see After the uncoating and when this viral genome is released, there will be replication. Okay. In this replication, you are seeing there are some DNA viruses, okay, which is releasing the viral DNA, and if they are releasing the viral DNA will undergoes this transcription procedure. In the transcription, what is going? This DNA is forming the mRNA, messenger RNA. This messenger RNA is essential for the step number 6, translation, protein synthesis. So, this messenger RNA will undergoes this translation and will form some viral RNA. Yes, the proteins, the formation of proteins will occur at this step. Okay. Now, there is another condition, means this step we are seeing after the translation there the proteins are formed, okay, which are the functional proteins. Now, here there is a second scenario. If the virus is containing the viral RNA, okay. So, this viral RNA directly undergoes the translation step, means the proteins will form. Okay. So, there we can see there are two steps here, one is from the viral RNA and another is from the viral DNA. Okay. Now, see, in the translation procedure, whatever the proteins are formed, which are the functional proteins, yes, the late proteins, they will start to assemble. Now, the new viral particles are formed. Okay. So, assembly of newly produced viral elements, they will go and they will release. Okay. This is the step number 8, and in this release what happened? There is a release of new virins by budding. This step is budding, means they will go out. Okay. Exocytosis outside the cell, okay, and host cell lysis, or they will, means the cell will destructure and the viral particles will come out. When they will come out, they will start and they will go outside and they will infect some other host cells. So, the same phenomena will again we'll see it in another cell. Similarly, they will spread in the another cell and then will liberate out. Okay. So, this is how the viral infection is spreaded all over the body. Now, we will see the drugs, okay, the antiviral drugs which are acting on these steps. So, we will start with the uncoating part. Here the capsid layer which is deassemble. Okay. So, when the capsid layer is deassembled, here there are two drugs like amantadine and rimantadine, they are working. Okay. They are working on this part and they will inhibit the uncoating of this virus. If it will not uncoat, what will happen? The content will not be liberated out, the viral genome will not liberated out, the another steps will not be proceeded. Now, after in the uncoat, means when there is uncoating, there will be the formation of early protein synthesis. So, Formivirsin, this is one of the drug. This is effected on the step where the DNA polymerase are formed, which is known as early protein synthesis. Okay. Now, we will see if the DNA polymerase synthesis or these enzymes are formed, there is a formation of DNA or RNA. Okay. So, nucleic acid synthesis is the next step. Anti-metabolite or some RTIs, reverse transcriptase inhibitors, they are acting on this step. Yes. Then late protein synthesis and processing. Okay. Late protein synthesis and processing means there is the formation of proteins after the when the viral DNA, viral RNA is undergoing the procedure of translation. Okay. So, the functional proteins which is formed at the step of this late protein synthesis, at this part this protease inhibitors will work. Okay. Here we are seeing after the formation of the proteins there is one step, that is packaging. Okay. So, rifampicin is one of the drug which is acting on the packaging part. Then there is, we are seeing the release of viruses. The viral coats which are newly formed, means new viruses which are formed, they will come out of the cell. So, there are some drugs which are neuroaminidase inhibitors. Okay. Neuroaminidase enzyme is very essential for the exocytosis of the viruses from the host cell. So, the neuroaminidase inhibitors are acting on this part where the new virulent particles are going outside of the cell. So, they will inhibit the neuroaminidase enzyme, which is essential or required for making the viral particles to go out of the cell. Okay. So, this is all these steps we have covered. Here we have a one category which we have missed out is enfuvetide, maraviroc, docusenal and pelivizumab. Okay. These drugs will act on the very initial step when the viruses are start to fused with the host cell. So, viral fusion with the host cell and entry. Okay. So, they will act on this part where the penetration is occurring. Okay. So, this is all we have covered in the this mechanism part, means where these drugs are acting or on which of the steps. So, one of the category which I have discussed previous is the neuroaminidase inhibitors. Yes. So, neuroaminidase inhibitor, what they are doing? They are inhibiting the neuroaminidase enzyme. Yes, neuroaminidase enzyme is beneficial for exocytosis of the new virus particles which are formed in the host cell, so that they can out of the cell. Okay, they can out of the host cell. Now, you are seeing here, this is a host cell nucleus, receptor containing salic acid. Okay, here we are seeing. Now, there is a budding virus. We are seeing there is a budding virus and there is a neuroaminidase cleaves receptor, this area. Okay. Now, we are seeing there are two types of enzyme. One is a neuroaminidase. Similarly, we have a hemagglutinin enzyme. Okay. This hemagglutinin is essential while the penetration of the viruses to the host cell. Okay. So, here we are talking of this hemagglutinin as well as neuroaminidase. Neuroaminidase we are seeing it is used for the cleavage. Okay. This is the virus particle and the release of new virins we can see. So, when the neuroaminidase will act on this receptor, there will be cleavage, there will be cut, okay, from the host cell to the this linkage, the host cell to the viruses. So, there will be continued viral replication, it will come out. Okay. So, you can see here how it is going on. Now, in the second, in the B part, you can see we have given neuroaminidase inhibitors. Okay, these are the drugs. Now, what they will do? They will go on this area. So, neuroaminidase will not going to affect on this step. Okay. Neuroaminidase will not cause the cleavage of this host cell to the virion. So, it will not come out of the cell. So, there will be halted viral replication. Okay. These new viral virus particles which is formed in the host cell, they are not going to spread in the other cells. Okay. So, this is how we have halted the infection. Now, see anti-Herpes drugs. Okay. So, what we have discussed initially is the what are the steps of the viral replication, what could be the drugs, how they can act on the various steps of the virus replication. Now, there is one of the infection which is the herpes infection. Okay. So, for the herpes infection, treatment of herpes infection, we have anti-Herpes drugs. Now, most of these drugs are anti-metabolites and they are inhibiting the viral DNA polymerase. They need to be activated inside the body by some of the enzyme kinases. Okay. Now, under this we have acyclovir and its congeners or its different form. Acyclovir is one of the very effective drug which is used in the treatment of herpes infection. Okay. So, it is a guanosine analog active against herpes simplex virus, okay, and varicella zoster virus which is causing chicken pox. Acyclovir is not active against CMV infection, cytomegalovirus infection. Okay. Now, see how it is activated inside the body. So, acyclovir is activated by virus specific kinase. It is using one of the enzyme of virus, okay, and it will convert into acyclovir monophosphate. Then it will again use the host kinase, okay, to form acyclovir triphosphate. So, there are two steps. One is acyclovir is using the virus specific kinase and another it is using the host kinase, yes, and ultimately it is forming the acyclovir triphosphate, which is the effective form, okay. Now, what this will do, because it has a structural resemblance with the formation of these nucleotides which are important for the DNA formation. So, it will take the places of those of the nucleotides and ultimately it will inhibit the formation or the functioning of the DNA to RNA and then the formation of the late proteins, yes. So, this product competitively inhibit the action of DNA polymerase and it will incorporate it in the DNA, which I told you, okay. So, there will be chain termination, there will be no formation of the RNA, further there will be no transcription procedure, no translation. How it can be given? Topically, orally or IV. Short T-half and therefore, it has a short T-half, therefore, it requires the multiple daily dosing, okay. Excreted by kidneys, where it can be used? So, for mucocutaneous skin related genital herpes and for the prophylaxis of herpes infection in AIDS patient or immunocompromised patients. Gencyclovir, okay, this is another congener of acyclovir. So, it is effective against CMV, cytomegalovirus, for which the acyclovir is not effective, okay, and HSV, herpes simplex virus. Act by inhibiting same DNA polymerase. These congeners have the ability, means they are forming some of the metabolites which has a structural resemblance with some of the nucleotides. They will incorporate in the DNA and they will cause the chain termination, okay. So, first for phosphorylation reaction is a virus specific, they are using the virus kinase, okay. Gencyclovir is used only intravenously, whereas there is another form of gencyclovir which is known as Gencyclovir, that has a good absorption. So, we can also prescribe it orally. What it will cause? It will cause the bone marrow suppression. The drugs which are acting on the DNA, okay, which are acting as metabolite, those drugs has the ability to cause bone marrow suppression, okay. CNS side effects like headache to convulsions, okay. Now, see cidofovir. Cidofovir is also used for the treatment of herpes. Now, it is activated exclusively by the host cell kinase. It is only requiring host cell kinase, not the virus specific kinase. It is active against herpes simplex virus, cytomegalovirus, adenovirus or papilloma virus. There is some form of cancers also, for that it is effective, cidofovir, okay. Now, its diphosphate product has long T-half, okay. There will be formation of first diphosphate and then the triphosphate. So, diphosphate has long T-half. What is the long dose limiting toxicity? It will cause kidney toxicity, yes. The drugs like probenecid and IV saline, these two drugs will decrease the nephrotoxicity. How? They will reduce the reabsorption of the cidofovir compound from the kidney. So, it will eliminate out from the kidney this cidofovir, okay. If it is not reabsorbed, it will go out from the kidney and there is less chances of nephrotoxicity, okay. It will not accumulate in the blood when it is given with these two formulations. Now, ocular toxicity including uveitis and iritis, these are the eye inflammation, okay, is one of the another complication we have seen with cidofovir. It is considered as potential human carcinogen, okay. It has a capability to cause cancer. Apart from it, Foscarnet. Foscarnet, it is not an anti-metabolite, does not require intracellular activation by viral or cellular kinase. It is activated by itself. It does not need to change into diphosphate or triphosphate compounds. Okay. It is effective intravenously for cytomegalovirus infection. Nephrotoxicity means kidney damage is there in 30% cases. It is also causing low magnesium levels in the blood and low calcium levels in the blood. There is also CNS problems like confusion, okay, convulsions. These are some of the adverse effects of cidofovir. Other drugs apart from it, idoxuridine, trifluuridine, formivircin, docucinol, they are also effective for the herpes infection. Yes. Now formivircin. Formivircin, I told you, this is one of the drug which is active against the herpes infection, as of they are acting as first antisense oligonucleotide, and they are effective for cytomegalovirus retinitis, okay, which is affecting the retina, this virus. Resistant to other drugs. When the other drugs are not effective, then the these formivircin or dococinol, these type of drugs are given. Okay. Next is a dococinol, which is a long chain saturated alcohol compound. They are the alcohol derivative, which is given for topical or for the topical infection which is caused by herpes labialis. This is affecting mainly the lips area. Yes. So, dococinol, it is acting on the step where there will be the entry of the virus to the host cell. So, at the penetration step, it prevents the entry of the virus in the cell by inhibiting the fusion of virus envelope to the cell membrane. Coming to the next viral infection, influenza. Okay. So, for the influenza, we have anti-influenza drugs. Okay. What are the symptoms of the influenza? Cold and cough, yes. So, there will be chills, there will be fever, okay, there will be headache, body pain. These are some common symptoms. Now, anti-influenza drugs include amantadine, rimantadine, oseltamivir and zanamivir. Yes. Now, amantadine and rimantadine, these two drugs, they are preventing the uncoating of influenza A virus. If they will prevent the uncoating, of course, the capsid layer will not deassemble. If it will not deassemble, what will happen? The DNA or RNA, these compounds will not form, okay, and the functional proteins will not form, new viral particles will not form. So, this drug decreases the duration of symptoms of influenza. Rimantadine is better over amantadine because it has a longer acting effect. Yes. Some common adverse effects like GIT and minor CNS effects. Okay. Amantadine is a dopamine agonist, that is why it is preferred for the Parkinson's treatment also. Oseltamivir and zanamivir, these two drugs, they are neuroaminidase inhibitors. Yes. So, neuroaminidase inhibitors means they will inhibit the enzyme neuroaminidase, which is essential for these viral particles to come out of the host cell. Okay. So, they will prevent the virin release by causing clumping or mature virins. These drugs are effective against both influenza A infection or influenza B infection. Now, oseltamivir is one of the drug, oral prodrug, which can cause nausea and vomiting, okay, and zanamivir is administered by inhalation routes. So, there is a difference in the routes also. Now, it is given by inhalation routes, that is why you can see there is a one side effect which is related with this area is bronchospasm. Okay. It is also causing neuropsychiatric disorders, okay, which includes suicidal tendency. Okay. So, this is also one of the effect we have seen the patient who are taking the these drugs, oseltamivir or zanamivir. Okay.